Hello and welcome back to Ticket Talks, and together with Polaron Language Services we are looking to use language to connect communities. And whilst Polaron is the sponsor of our program, all of the views and opinions in the following program are of course our own. And before we get started, I would also like to acknowledge that this segment is being held on the traditional lands of the Wurundjeri Woi-wurrung people, and I pay my respects to elders both past, present and future of course. And I am joined by Director of Polaron Language Services, Eva Hussein. Welcome to the program, welcome back.
Hello Mike, we missed you. Holly did a good job, but you are irreplaceable, let me tell you.
Bless. I love that. Thank you. Now, what have you guys been up to at Polaron this week? What sort of projects have you guys been working on?
Busy. This week we're showcasing mental health. I think it's fair to say that in the mainstream there's lots of conversations going on around that because of lockdowns and bad news everywhere. We're going to showcase a little project we did a while ago, which is called Head to Help. We've done a translation of an app, essentially, of a website into 14 languages. And it connects communities with mental health professionals that speak their language. So it's a really good way of people being able to reach out in the right way to the right people. As part of this project, we've also worked very closely with our translators and interpreters because it's so important that we get the language right, we know how the communities speak, and so there was a lot of consultation, a lot of hard work, but we're very, very proud of this particular project.
Yeah. Awesome. All right, well, let's touch on miscommunication of the week. What have you seen out there in the wild world of mistranslation?
Mike, it's really difficult to explain how translation works for people that aren't in the profession. So I did a little exercise a while ago, and I put a website through Google Translate. So on the screen there you can see that this is it happens to be a Polish website, which is the language that I speak. And you can see terrible mistakes that automated translations can provide if you're not careful. So out there are lots of mainstream organisations that provide mental health in Australia, but if you're thinking about enabling automated translations, be careful because the wording that some of the machine translation uses is not culturally appropriate. It can put people off. It can really make people not reach out for help as they need it.
100%, and it only takes one or two words to be out of whack to really throw things into the gutter, unfortunately.
Yeah, particularly that there's still a lot of stigma around mental health and seeking help and all of that. So if you go to our website and you can't find the information in your language immediately, you have to, if you have to click and click, or there's something not quite right, you're not going to go to that organisation to get.
Following on from this, and this week we're discussing mental health in multicultural communities. And whilst Australia is increasingly getting better at speaking up about mental health and reducing the stigma that surrounds mental health care, people from diverse communities don't always get the support that they need. A 2017 study found that due to traumatic experiences, refugees were more than 3 times as likely to be suffering from PTSD than people born in Australia. Yet, people from diverse backgrounds face further barriers to accessing healthcare. What's up with that? Let's unpack this with our guests for today. And Niharika Hiremath is the National Mental Health Advocate and Commissioner for the National Mental Health Commission. She's passionate about working to understand and reduce stigma that surrounds mental health, especially in ethnically diverse communities as well. Ruth is our other guest, and she's the National Project Manager at Embrace Multicultural Mental Health. She has worked for over a decade in the healthcare sector for government, NGOs and multicultural communities as well to achieve equitable outcomes in healthcare that goes across Australia. And who better to discuss today's topic with than these guys? Thank you for joining us.
Thanks for having us.
Thank you.
No worries. Now, Niharika, I'll start with you. It's probably fair to say that conversations around mental health in Australia nowadays are slowly improving, I'd say, and help is out there. But why are the statistics telling us that people from diverse backgrounds still experience so many barriers when it comes to accessing mental health services?
I think there's definitely a number of reasons why that despite there being options for people to access, that folks from diverse backgrounds still struggle to access those mainstream mental health services. Many of these services were researched, designed, and actually continue to be implemented with westernized notions of mental well-being in mind. And so even if they do exist, they often don't adequately cater for the specific needs of culturally diverse communities. And as was mentioned before, this is on top of that existing stigma within these communities as well, and that reduced mental health literacy, which usually gets perpetuated throughout those collective systems. And amongst other challenges, mental health services may not consider sort of the ongoing impacts of for example, immigration and settlement processes, colonization, or the compounding effects of systemic issues such as racism or discrimination play a pretty significant role in a person's mental well-being. And these also accompany those more practical barriers, as were mentioned before, such as language, and not just direct, but also those conditions as well.
I think the compounding factors is interesting. Ruth, can I ask you the same question? Let's talk through those barriers again, just in your opinion.
Sure. So, as you can imagine, for a lot of people in different culturally diverse communities, talking about mental health can be quite difficult. They might have a lot of stigma attached around what it might mean to have a mental health problem or a mental health condition. They might have really well-based fears of being stigmatized and ostracized in their own communities. They might feel that they're going to be alienated or put aside from usual community events, or they might be afraid of the way their family might be perceived or treated within their own community. So that fear of ostracism or fear of what that might mean in terms of their reputation or confidentiality might be very, very real in lots of different communities. As we've also mentioned, the fear of past experiences with health services. Sometimes health services in people's countries of origin might not have been ideal, and unfortunately people do have experience of bad treatment in countries of origin. Maybe if they've come from a refugee background or an asylum seeker, they might have fear of persecution in their home country, and that might be affecting the way that they perceive community or government services in Australia. So that fear of accessing services might be really real and might prevent someone from seeking help or support here in Australia. We do know that there's a lot of research that shows that there are different methods of explaining mental health according to people's culture. Here in Australia, we use a very a biological view of mental health. It's a disease, it's got illnesses, it can be treated. But in other cultures, mental health can be seen in a very different way of understanding of what causes mental health and what causes mental health issues and what you might need to do to seek treatment for that. So we need to think about what those causes or understanding of mental health conditions might be, but also what might be seen as ways of treating those mental health conditions, and that can really vary from culture to culture. So it is quite a complex way of understanding mental health and mental health diseases and illness, and also how we respond and treat those issues within our different communities.
There are so many layers to this. So continuing on from that, how can mental health services for diverse communities actually be improved?
Sure. So I think that's a really good question, and certainly the Embrace project, which is funded by the Commonwealth Department, really exists to better equip mental health services to work with people from different cultural backgrounds. So within the Embrace project, we have a framework for mental health in Multicultural Australia, which is a tool that services can use to systematically assess how they're delivering their service and how they can improve their service to be more culturally responsive. I guess the really first point is that people need to use, or mental health services need to use, professional and accredited interpreters. That is absolutely critical to communicating to people from different cultural backgrounds. We know that still some services rely on family members, relatives or friends to do interpreting for them at mental health services, and really that's not going to provide a good quality service. We know that professional accredited interpreters are trained to provide mental health services in a professional way. They understand the terminology, they understand the issues, they understand the processes of accessing mental health services, and they are really the best people to use in translating. So I think the first thing to do is use a professional accredited interpreter that can be accessed through the National Interpreting Service TIS. The second thing to do is
That's okay.
is just to try and create a really positive relationship that is going to build rapport and trust with people. So establishing that you're trying to help people, that you want to help them, you work with them, you work with their family, you work with their community to build a supportive environment for them to receive the right treatment.
Yeah, everything that Ruth had mentioned is incredibly important, and especially the point around translators and the importance of having translators who have and interpreters who have that working knowledge of what the mental health system looks like and the implications of the kind of knowledge that they use in those settings, not only on that particular circumstance, but sort of stigma more broadly as well. A lot of what I've been hearing is also around that contextual translation piece, and not just for language translation and in resources, but just more generally around tailoring services to the needs of communities. So Ruth was talking about the importance of building that rapport and that trust. And I think a lot of it is around the time and the intentionality in really building strong relationships and bridging the gaps in understanding for cultural communities, but also meeting them where they are and understanding that they have knowledge about the way in which their society and their sort of worlds have functioned, and being able to really integrate that more deeply into the service that you're providing. I think, yeah, as Ruth was saying, like with all of the sort of clinical or pathologizing language and systems that the mental health sort of space tends to really strongly draw upon, it's important to really acknowledge how much culture can be a part of that identity and the broader well-being piece, rather than just a pathological thing. So some things to think about, and funding as well, at just being able to really support the funding for translation services of resources or funding for interpreters is so important, and especially in local and community settings where it can cost a lot and often can be under prioritized. So
let's touch on one of the more known sort of methods to get support with Lifeline. And April this year, over 80,000 calls were made to Lifeline, which was an increase of almost 20% from the number of calls the year prior. So the pandemic is clearly negatively affecting people's mental health. How has it specifically affected people from culturally and linguistically diverse backgrounds? What have you guys seen? Ruth, do you want to grab this one?
Sure. So we know that particularly the COVID-19 pandemic has affected people across the world. It's a global problem. And so particularly for people who come from countries like India or where there's been really serious outbreaks of coronavirus or COVID-19 this year, they've been very distressed and concerned about their family and loved ones at home and about the treatment they might be able to access or might not be able to access. And so I think that's really had an impact on how people are feeling. People are very worried, people are very stressed about the impact of what the pandemic will have on them and their loved ones overseas. So I think that's the first point to make. I think secondly, there's a lot of misinformation and a lot of fear around what COVID-19 is. And unfortunately, there's some poor information that's not actually correct that's been around. We've talked about the importance of having the right translation and the right words translated correctly already today. So that's a really important thing, to get the right accurate information about vaccines, about what coronavirus is, how to protect yourself, how to protect your family, and getting the right information to people. So I think people are feeling that they're stressed, they're worried about their family and their loved ones. Sometimes people might feel very isolated, not being able to access the right information. They might be confused. And unfortunately, we are seeing some communities where they're being unfairly stigmatised as being, that's not helpful.
Guys, and I want to thank you both for joining me on the program today. Unfortunately, that's all we've got time for, but thanks to you both, and we'll have to catch up again down the track, because this is an important one. Eva, amazing guests as always. Before we do go, I did want to touch on what's been going on in Afghanistan, if possible.
Translators, interpreters, people like myself, we often work in the background. But today, I want everybody to think of us, of those people in Afghanistan that have worked with the Allied forces as interpreters and translators at the forefront of everything. Their lives are in danger. Just before we came on air, I think the Prime Minister was making an announcement, and I'm keeping my fingers crossed that we're going to get these people out of the danger zone. But it's just heartbreaking watching people that have assisted with communication for Australians, for Americans, for everybody else, was there left in a lurch. So I'm hoping that situation will be sorted out soon. If you can put pressure on anybody you can to get them out into safety. I think Allied forces do have obligation, at countries that pulled out do have an obligation to get interpreters and translators out safely.
Thanks for that. But ongoing situation as always, and thank you for coming on today's episode.
Thank you.
Now guys, if you have any questions about how to reach your multicultural audiences, get in touch with the team at Polaron. Contact details are on the screen. I'm Mike Loader. That's today's episode of Ticker Talks, and I look forward to seeing you again soon.